Education series. In this segment, we hope to give you an understanding of the muscles that will be supporting your growing uterus as you progress through pregnancy. The most important area that undergoes significant changes as you progress through the different stages of your pregnancy can be identified as your pelvic basket. This basket has the bony stability of your two pelvic or hip bones as borders on the side and your tailbone in the back. It's the soft tissue of your transversus abdominis muscle, or your TA, that encircles the front of your pelvic basket, and the soft tissue of your pelvic floor muscles that close off the bottom of the basket. These two soft tissue areas of your pelvic basket are the most stressed throughout your pregnancy. To help you identify these two areas, simply place your hands on your hip bones to feel the bony borders. As you roll your hands across the front of your pelvis, you'll feel the muscular area that is your transversus abdominis muscle. This muscle is able to stretch through the length of its fibers as your pregnancy progresses, offering support to your growing belly as well as to your low back. It's important to recognize that you maintain the ability to activate your transversus abdominis muscle throughout your pregnancy. Maintaining good tone in that TA muscle plays a big role in supporting your pelvic floor as well as offering stability to your low back and pelvis. Now that we have identified your transversus abdominis muscle at the front of our pelvic basket, we'll work to find the bottom of your pelvic basket. If you place your hand on your pubic bone and roll your hand just beneath this bony landmark, you now can feel the soft tissue of your pelvic floor. The muscular and connective tissue that makes up your pelvic floor spans this open area, extending back to your tailbone and spanning the area between your two sit bones. The expectation is for your pelvic floor to cradle and support your bowel, bladder, and uterus, as well as to control the passage of solids, liquids, and air from our bodies. This significant responsibility is shared by the 4 layers of muscular and connective tissue that make up your pelvic floor. Pregnancy and childbirth are additional challenges for this soft tissue area. It has been reported that your pelvic floor muscles can stretch up to 3 times their original length during late-term pregnancy and delivery. This is logical, as every extra pound that you carry within your abdomen and pelvis is an extra pound that your pelvic floor must support throughout your pregnancy. It's this direct stress on the pelvic floor that often produces symptoms of occasional urine leakage during pregnancy, as these strained muscle fibers lose their ability to fire effectively. These incontinence symptoms most often increase in the 3rd trimester, when your baby and your uterus grow most rapidly, placing more pressure on your pelvic floor muscles and your bladder. The stress on the pelvic floor tissue increases as women approach delivery, requiring their pelvic floor to stretch to its limit and often beyond, resulting in tearing of the muscles. If cesarean delivery is required, it's the transversus abdominis muscle that is compromised, requiring cutting of these muscle fibers as well as an incision of the uterus itself. Recognizing the changes that your body goes through during pregnancy and the further trauma that the tissues undergo with vaginal or cesarean delivery highlights the importance of strengthening the muscular tissue of your pelvic floor and your pelvic basket as you progress through pregnancy. Consistent exercise of all of the muscles of your pelvic basket will help to ensure efficient communication between the nerves and muscles as they change in length and experience increased strain. Keeping the communication between our nerves and our muscles primed will not only help throughout your pregnancy, but will also help those muscles recover more quickly following delivery. Common symptoms that women experience following their delivery as their muscles work to recover are urine leakage, prolapse of one or more of their pelvic organs, pelvic floor pain, low back pain, or hip pain. All of these symptoms can be the result of ineffective muscle activation or inadequate muscle strength following the trauma of pregnancy and delivery. Preparing your body with appropriate strengthening exercises for your pelvic floor and your entire pelvic basket can help to prevent the muscle dysfunction that can cause these symptoms. Studies within the field of physical therapy have shown a reduction in many of these symptoms of pelvic floor dysfunction simply with patient education alone. I hope I've helped to make you aware of some of the changes that your body will go through during pregnancy, so you can work to prevent your own pelvic floor dysfunction. Thank you for choosing the Habit Pelvic Floor Patient Education Series.